Good afternoon. Here we are again, the two wise birds. So I'm Jane Lelean from the Institute of Dental Business, a business coach and dentist. And Sue, would you like to introduce yourself?
Thank you. And I'm Sue Boynton. I'm a dentist and I'm an independent dental legal consultant.
Fantastic. So, Sue, two wise birds. What we've been doing is just not tweeting, but we're talking about what we notice is going on in the dental community and offering the people that are watching these videos some tips and tools that will help them survive and thrive during COVID. So, what do you think that people really should be considering this week?
Yeah, and I think that's a really good question because people are getting ready to go back to work after the Prime Minister spoke on Sunday evening. There's uncertainty as to what's happening with us in dentistry. We're not back yet, but it's time to start planning on how we're going to get back. Things aren't going to be the same. And we know, Jane, that we don't know precisely what's going to happen. In other words, there's quite a bit of uncertainty, but we know that we have to plan, and there are some aspects that I think practices can plan. What are you thinking?
Well, do you know what? I think that you're absolutely right because we don't know. We really don't know when we're going to go back. When we do go back, we don't know what we're going to be wearing. We don't know about the number of patients, the frequency. There is so much that is going to be different when we go back. And yet, the stuff that is going to be almost the same, but it needs to be tweaked and adjusted, and everybody from the team needs to be involved and prepared so that when we get told by the CDO, yes, you can go back on such and such a date, it's not a mad panic and a mad scramble of how we get it implemented. So I think this planning to plan is a really useful time, because what I would be really fearful of is that come September, somewhere between September and December, that people say, I really wish I had of.
Mm.
So we've got some time, so let's use it effectively to improve what we've got. So what sort of things do you think that people should be planning?
I think that we know that there's going to be some sort of downtime even when we're back in practice. Practice isn't going to open up the same as it was before. We're not going to be able to do treatment straight away, certainly not aerosol generating procedures. We need to be looking at patient journeys. We need to be looking at when there's downtime in the surgery. That might be 30 minutes between appointments. It might be more between appointments. We simply don't know. What we do in time. And the other thing we're going to be having to do linked with that is message our patients.
Yeah.
I heard from a lot of dentists, on Sunday evening, they've been having messages straight away from patients saying, oh, wow, you're opening up tomorrow. Can I have an appointment? Can you complete my treatment? Can you do this? Can you do that? And then other patients saying, if you are opening, I'm too scared to come. So
Yeah.
we need to be managing our messages to patients and managing their expectations. We can start that right now.
Absolutely. And you know that one of those tenets that I keep coming back to time and time again is patients don't remember what you say, they don't remember what you do, they do remember how you make them feel. So now and when we go back, how do we make our patients feel? How do we want them to feel about their relationship with us? Is it about safe? Is it about reassured? Is it about certainty? Is it about predictability? Whatever we think our patients need, how do we communicate those messages that actually, when we do go back, we've got their best interests at heart?
Absolutely, and they know that we have.
Mm-hmm.
And I think what's really good now is we've got loads of opportunities to do that. Everybody's getting good at using video communication, as we're seeing here. There's loads of different platforms that people are using now. There's loads of social media platforms that we can go on as well. We know that people like information in different ways.
Yeah,
So there can be podcasts, there can be videos, there can be little Instagram pictures, there can be things on Facebook. And different people in the practice can convey the same message in slightly different ways. The
absolutely.
way you and I would say the message that's approved might be different from the way our newest dental nurse says it, and that's fine because
Absolutely.
that can be received in different ways by patients and the public. I'd like to see people getting ready to do that, you know.
Absolutely. And I love the word that you use there, lots. I think that this is not that we write our patients one letter and that's it, we've done our patient communication. I think it needs to be drip, 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 frequently, little amounts. And yes, I'm not saying that we don't need to send a letter to all our patients, because for some patients, they like to feel that hard copy letter. But that's only going to be one of many communication channels that we just keep reinforcing the messages that we've got their best interests at heart. And we will open when and only when we've been told to and we can do it safely.
Absolutely, and I think this is our chance to push the safety message. We can tell patients and the public that dentists and dental teams are fabulous at infection control, and we always have been. There'll
Yeah,
be some tweaks and differences when we get back, but by Jove, we've always been ahead of the game.
absolutely.
I like the idea of different messages going out in different ways. What we want to be careful of is not to be just transmitting messages. We need to be also saying to patients, come and talk to us, ring
Absolutely.
us up, video us, FaceTime us, whatever, we're here for you. There's no question that's too small, or do you just want to chat?
Absolutely.
You know you need some fillings doing, you might be worried about them. Ring up and we'll chat through the scenarios at the moment and what you, Mrs. Patient, can be doing to look after your teeth in the best way in the meantime. We'll
Absolutely.
reinforce that.
Absolutely. I don't think triage calls needs to be just triage, sorting out the patients in pain and then sending them down the appropriate pathways. It is that communication and reassurance and being proactive as well. So if we know that patients have got big treatment plans, well,
Yeah.
let's just ring them and reassure them, put their mind at rest. Yeah, it's really important.
I think it is. And then added to that, you've probably got patients that haven't got big treatment plans, but may well have in the future, might have been thinking about some cosmetic work, some whitening. It's a chance for them to chat about it if they want to as well. You know, I remember I was in 3 months ago and you started talking to me about that. I can't remember exactly what you said. Can we go through it again? I think that's a fabulous opportunity.
Yeah. And I've got one of my clients that's been using one of our processes, and in a week, she started having these informal conversations, and in 1 week, she generated a reservoir of potentially £20,000 worth of treatment. Now, that treatment might not be started immediately, but for those practices that are out there that are concerned about where is the money going to come from, this is the perfect time to start building those reservoirs of patients that are eager to go ahead with treatment as and when we can do the APGs and AGPs even, that they've got them in the bank. Wouldn't it be a sensible thing to do?
Yeah. Well, that's right. And this all adds to the messages we're spreading in the community as well. So we're spreading the messages to patients and the public. We're there for you to talk to at the moment. And as soon as we're going to be there face to face, we'll let you know about that. And in the meantime, you need to know more about dentistry. These are the other things we can do. Yes, we're treating disease, pathology, that sort of thing, but there are also nice cosmetic things that we can do as
Absolutely.
well. And I think a lot of people need to know more about that.
Absolutely. And so I think it's two ends. So we've got the aesthetic, the improvement, the stuff that changes the quality of patients' life. But also this is an amazing opportunity to go back to basics.
Yeah.
What do patients need to be doing to be looking after their dental health? This is the stuff that we see people that maybe haven't got out of their pajamas all day, going back and reinforcing dental hygiene, how to use floss. And if you've got kids, I'm sure it's going to be every parent's nightmare that the kid's out on the scooter and they fall over and knock out a tooth. There could be some stuff out there. How do you manage an avul's tooth?
Yeah, I think that's a really good idea. The A&E doctors are saying at the moment that most of the accidents that they're seeing from children are from trampolining
Oh,
accidents.
goodness me.
And I have to say, walking around here, and we've got some lovely walks around here, I'm seeing more and more trampolines popping up in people's gardens.
Do you know what? I used to be a trampolining coach, and trampolines in the garden bring me sort of like panics. No!
Absolutely. Wow, I didn't know that, Jane. You are an enigma, I would say. But you're right. So that messaging needs to be out there for parents and friends. If there is an accident that involves teeth, this is where you can get advice from. This is the general quick advice. And get on the phone. Dentists aren't closed.
No.
We're open. We're just not open face to
Get
face.
that tooth in there quickly. So, from a medical legal point of view, Sue, what do you think that dentists and their teams should be re-evaluating from a medico-legal point of view, preparing for when we do go back?
Yeah. It's making sure, first of all, that your procedures and protocols are up to date and aligned with the standard operating procedure for that time. Okay, so everybody has to be up to date with what's in their nation. Then we need to be carefully keeping our detailed records and carefully taking the patients through the consent process, because there will be things that we would normally discuss with the patient that simply aren't going to be available. And we need to tell them that and explain why and explain the significance of it
And
as
what
well.
specific things are you thinking about there?
Do you know, we had a thing the other day. A friend of ours, her daughter's 16, just getting ready to do her exams, of course, which she can't do. She's had a grumbling tooth for 6 that she's had filled. It's flared up. She's had antibiotics. It's flared up again. She's had more antibiotics. Had to go to the emergency dentist, and they are saying quite rightly, the only choice now is more antibiotics, which you and I know probably won't work, or extraction. There is no other option at the moment. And it's that careful discussion that has to take place so the patient makes the informed decision. And I think that's really, really important, and that has to be carefully documented as well.
Okay, so there could be some stuff about writing information leaflets out there as well, so that patients can see it, consider it, reflect on it.
I think that's absolutely right. It's having information in different ways, and so that the patient has got specific information to their specific situation as well. So some good general stuff for education and specific stuff for them too, and then being able to prove it, because I suspect there will be challenges further down the line. And I know the indemnity organisations are saying at the moment that the government should change things so nobody can sue anyone in relation to COVID-related advice and treatment. Whether that's going to happen or not, I'm not confident.
Yeah,
So
I
we need to be
know.
ready.
Yeah, and it's difficult. It's a difficult situation. And if we're not allowed to open teeth up, we're not allowed to open teeth up. And
Absolutely.
it's difficult for the patients, but it's also difficult for the dentist concerned.
Yeah. That's why there has to be that honest conversation where everybody knows where they stand. And there has to be that trust as well. And what you talked about earlier, and we talked about giving information to patients and being open to them and inviting them to call us, that all builds that trust.
Absolutely.
The more trust there is, the less likely a patient is to make a complaint if they're not happy with something at a later date.
Absolutely. That open honesty, truthfulness. Absolutely.
Yeah.
I know you don't have a crystal ball, but if you did have a crystal ball, what do you think is going to be different about our appointments when we do go back?
Do you know, in a way, this is a good opportunity for us. Nobody would have wished COVID-19 and some horrendous things have happened. For dentistry to close was unprecedented, and we're seeing that word all the time. But it's almost like there's a new start when we go back. I talk to so many dentists who've run into bother, and they're saying, well, I can't change this because I can't change my appointment book. It's booked up for 3 months, 6 months. This is our chance. We've got a blank page to think about, what do we want? What do we want from life? What do we want from dentistry?
Yeah.
And in dentistry, how do we want to work? How do we want to organise our day and our appointment book?
I know.
It's a new start.
I know. I think it's really exciting for exactly those reasons. I'm working with lots of people at the moment that just say, I don't know whether I want to go back to dentistry. And when we unpick it, it's not that they don't want to go back to dentistry. They don't want to go back to dentistry the way they were expected to do it before. So having got off the treadmill, they don't want to go back on. So having control of our appointment books and redesigning them, I think, is a great idea. And now obviously we don't know whether it's going to be fixed, but if we can start to consider what's important to us, what's important to our team, then we can start to create a framework and start thinking, how do we want our practices to operate?
Well, that's right. And I think in conjunction with that, it's thinking about when we do get the go ahead, which patients do we need to be getting in first?
Yeah,
Because when practices do open, all patients will think they're a priority. And I can totally understand why they'll think that. As a practice, we need to have that responsibility to prioritise our patients when we're putting them in as well.
absolutely.
And the other thing, of course, we're going to need is financial support
Yeah,
from the government. We
absolutely.
cannot do this for free. We can't do this for what we get paid at the moment either.
No, I think this whole UDA thing, I mean, I've been saying that people don't go back to the way they wanted to do it before, but they're seeing somewhere between 20, 30 upwards patients a day. We know that's because that's what needed to be done to achieve the UDA targets. We can't do that, particularly if we've got downtime, anything from 30 minutes to an hour, depending on who you're listening to.
Yeah.
Something is going to the government's going to have to go back to the drawing board and decide how do they want dentistry going forward, because it can't be done in the same way. Even if we extend hours and start operating shifts, we can't do that capacity of work and do it well. Particularly with the added PPE. So I'm being told that the PPE, the full stuff is anywhere between £50 and £80 per patient. And we need to have honest conversations. Who is going to be paying for this? And not also that, who's going to be paying for the downtime?
Yeah, absolutely.
And the patients will think, oh, the practice can suck it up. But you know, and I know, that actually there isn't the slack in the practice to be able to do that. And those fees are going to need to be passed on to patients.
Yeah. And I think you're right. This is part of the conversations that we're getting patients ready for. I don't think it's time to be having those specific conversations with patients yet. I think this is the time still to be building up the relationships, building trust and being available. But eventually patients are going to need to be on side with this.
Absolutely.
And we may need them at our backs when we're challenging the government and saying we need this financing.
Absolutely.
So this is the opportunity now for careful messaging to patients, for opening ourselves up for patients to talk to us if we're not already, and then for thinking about in the practice, how do we want to operate?
Yeah. And what would you like people, I know what I would like to see them doing, and in that downtime, what would you like to see practices doing? Whether it's 30 minutes, an hour, how do you think it can be utilised? Because it can't be spent just sitting around drinking cups of tea and coffee.
You're absolutely right. And I think this is what people are worried about because they're seeing it as downtime. It can actually be usable time. We can use it with patients in a different way. How would it be if we had pre-consultations with patients? We're worried about them coming into the practice, but we get them on a video phone, FaceTime or whatever, and say, right, Mrs. Thing, your appointment is next week, next month or whatever. Let's have a chat in the meantime about what you're worried about. How did you get on with that upper left 6 that we did last time? What are you thinking of? It's certainly those discussions, and that's so valuable to the practice and patients as well. And it alleviates some of that disappointment when you say, Mrs. Patient, I can't fit you in for a month.
I know.
I can't fit you in physically, but we can have a chat. I've
Absolutely.
reserved some time for you.
I know. I think it's a potentially really exciting time. Dentists are always saying, I don't have enough time, I don't have enough time, I don't have enough time. Well, now we're being given this time. You know that I'm a fan of the idea of a patient care coordinator. And actually that those processes, that patient journey, they can be done by the patient care coordinators, they can be done by the associates, hygienists, therapists, the whole team can be brought in. And yeah, we maybe need some more IT stuff because we're not going to be sitting in the surgery, but absolutely we can be using this time to be building relationships, forward planning, building. We keep coming back to that trust, don't we? Trust is at the core of it.
Yeah, I thought so. How would you feel if you couldn't get an appointment with, say, your doctor for a month, but you could chat with them in the meantime? They say, yeah, I can't fit you in face to face, but I can chat to you this afternoon. We can have 15 minutes. How would that be? You'd feel reassured.
Absolutely. Absolutely.
Excellent.
Okay.
So we've got lots of good ideas between us, Jane.
We have, and I really, really do hope that the people that are watching these are taking away one or two little snippets and going, yeah, do you know what, I'm going to do it. They don't have to do the whole lot, but just make a start. do something, even if it's just talking to your team and asking the team, what do you think we should be doing? How do you think that we can be moving forward and preparing? And the other thing that I haven't mentioned that I do think is really important, and you know me, I love to look at other industries and see what they do really well. My uncle's an actor. Goodness me, you would never ever get any self-respecting actor to go on stage without rehearsing. And we know that plays are rehearsed for months. So this is the time to rehearse. I don't like using the word role play, but let's rehearse. So if we're planning a route through the practice, let's mock it up.
Yeah.
Let's get our team members to stand in as patients. How is it going to work? Do we have to do a telephone conversation for a medical history with the patient sat in the car? How do we get them to sign it? How do we make sure that the pen has been disinfected? How do we disinfect the pen after it? All those little tweaky things, because I'm sure you and other dentists see people wandering around the supermarkets with their masks and gloves on. The masks aren't on properly and the gloves, well, what use are they? They just don't get it.
Yeah, but it looks so good on Instagram.
I
Wearing your
know.
mask as a hairband or as a necklace. Yeah, I think you're right. There's that. And of course, the really important one, how do we get people to pay? Do they pay before? Do they pay after? A no-touch way of payment. And that might be installing something different in the practice.
Yeah,
Is
or
it worth thinking about that now, checking out different schemes that we can do?
well, hopefully they've got a credit card machine and they can do it customer not present, where the keys are just keyed in. Absolutely.
Have a look, as you say, and try it out.
Got to test it. And I think one of the best ways to do that is to rehearse. And we know that actors do that. If that line doesn't work or I'm in the wrong place of the stage, what can we do differently? We just rehearse, rehearse, rehearse. Yeah.
Yeah. And do you know what? People who rehearse look really professional and look really confident. And sometimes it's a time when you're building that confidence.
Absolutely.
It's important to appear it to a patient.
Yeah. Absolutely, because by the time the patient walks in, you know what you're doing. You're not having to think about it. So it's that mastery cycle, isn't it? Moving from that conscious competence to that unconscious competence, and that only comes through practice.
Yeah. So some brilliant ideas.
Brilliant ideas. And please, for those of you that are watching this, please let us know. Let us know what you would like us to talk about. But also let us know what you have taken away and used and what the results have been as a result.
Absolutely. Yeah.
Brilliant. So we'll see you again next week.
See you next week. Bye.
Bye.